afternoon. My name is Pamela Walker, and I'm going to talk about the national opiate crisis that is going on in society today. Um, there's an opiate crisis that is going on worldwide that is taking a toll on our healthcare industry. ERs are being consumed with patients coming in for pain medication repetitive times. This is taking away from the medical supplies that need to be used elsewhere in the hospital. It is taking hospital beds that can be used for more extensive conditions like cardiovascular issues, diabetes, and things like that. It's causing patients that come into the hospital to miss days of work. It's causing increased readmissions with no reimbursements for the readmissions. Because when they leave and they come back in a certain amount of time, the hospital loses money on those admissions. The impact of the opiate crisis in regards to health care is increased depression, increased anxiety for the patient, hypertension for the patient, tachycardia for the patient, potential overdoses, which causes EMT to have to go out to the house and resuscitate patients there. Symptoms of opiate withdrawal are anxiety, rhinorrhea, nausea and vomiting, abdominal pain, tachycardia, and hypertension. Signs and symptoms of opiate overdose include patients being unconscious, unresponsive, the body being limp and not having any kind of control, extreme drowsiness, slow, shallow, irregular breathing. The skin can be pale, cool, or clammy. Pupils can be pinpoint and fixed. Nurses have the potential to have opiate abuse also, mainly because of the stressful jobs that they encounter while they're at work. They tend to turn to drugs, tend to turn to opiates. They have family issues at home that makes them turn to opiates. When nurses are on opiates, it tends to make them have impaired judgment, slow response time, which in turn reflects on the patient that they're taking care of. They can't adequately take care of the patient because they can't respond fast enough, and they can't think about what's going on in a exact manner that they should. They're prone to more mistakes. They're nervous because they're worried about their coworkers finding out. They tend to have anger issues because of the opiates. There are several ways that we can help combat the opiate crisis. Physicians are the first line. They can be more cautious on prescribing the medications that they prescribe. First, they can try the first line defense of NSAIDs. NSAIDs include medications like opiates. NSAIDs includes medication like ibuprofen and things like that. They can do drug and urine testing on admissions to see if there's any prior drug use. If there is drug use, they can make referrals to pain medication clinics that are more adept to deal with pain issues. They need to allow more access to Narcan for first responders. Um, Nurses have a role in preventing opiate abuse also. On a mission, they need to obtain a medical history. They need to get an accurate list of past medicines that have been taken, along with medications that are being used now. They need to educate patients about their pain medications. And they need to ask about a history of drug abuse or alcohol abuse, because alcohol and drug abuse are related. Last but not least, nurses need to educate their patients. They need to educate, and educate. You can never educate a patient too much. Thank you very much for your time.